That's a great question because sea moss has been all the rage, right? And sea moss is actually seaweed. It's red seaweed. And there have been lots of claims about sea moss, like that it's good for your complexion, for digestion, for breathing and clearing up mucus, from getting rid of toxins. Here's the issue. We don't have any steady, large, randomized, controlled trials. And so there really is limited data to prove the benefits of sea moss. That being said, sea moss has been used for centuries. So if you look at some of the nutrients and minerals, we know that sea moss has calcium, it has magnesium, it has chromium, it has vitamin B2. And so it definitely has some antioxidants, lots of things with health benefits. But here's the flip side. Sea moss can also have certain substances that aren't good for everyone. It can have a lot of potassium. And if you're someone who has chronic kidney disease, for example, then it's important in most cases that you limit your potassium. Also, it can have some heavy metals. Yes, some sea moss can have heavy metals like lead, like mercury, like arsenic even. And because a lot of the sea moss products, we know they come in gels and pills and powders, many of them, or most of them I should say, are not FDA approved. And so you don't exactly know if you're being introduced to dangerous levels of heavy metals. It's a possibility. And the other thing about sea moss is that it has iodine, which definitely can be good, but if you're taking iodine in excess, then that can affect your thyroid function. So here's the bottom line. I do believe that sea moss does have some health benefits, but sea moss is not going to have the same benefits for everyone, and sea moss in excess can be toxic to people. In fact, if you look at some of the recommendations, some say that you should only have 2 tablespoons of sea moss, but a lot of people out here eating sea moss think that more is more, and so that's not necessarily so. So what you should do is consult with your physician, take the sea moss, the brand that you're actually wanting to take, the gel, and find out if sea moss is safe for you.
I am a vegan who eats a lot of canned beans, corn, and diced tomatoes. I rinse everything. A lot of sodium is in the liquid that they come in and can be deadly. So tell me this, am I correct? By Zona the Great.
Zona the Great? Oh, I like that. That's a great question, Zona. And so you're a vegan, and so congratulations. Having a plant-based lifestyle is definitely heart healthy, kidney healthy. It's just good for you. As far as the canned vegetables, so of course, the best choice would be fresh vegetables, right? Fresh vegetables, organic vegetables with no pesticides. But we also know that's the most expensive choice and not always the most convenient choice, because fresh vegetables can kind of go bad quickly in a lot of cases. So if you can't do the fresh vegetables, the next choice would be frozen vegetables, which tend not to have the added sodium. But again, if you don't have the space, a huge freezer to store the frozen vegetables, that might not be feasible either. The next best choice is going to be canned vegetables with low or no sodium added. But if you're having the canned vegetables that do have sodium added, that's definitely better than not having a plant-based diet, and rinsing them is the best thing to do. You want to dump out that salty stock that's in there, and you want to replace it with rinsed vegetables. That being said, some of the salt will have been soaked into the vegetables. That's just inevitable, but this is the best case scenario when eating canned vegetables. You are doing the right thing for canned vegetables. Remember that the recommendation for most people is to have less than 1,500 milligrams of sodium per day, because if you have higher than that, that can increase your risk for hypertension.
A nephrologist is not an expert in high blood pressure. There is no such thing as a doctor of HBP. Frida is a kidney doctor, period.
SLS, are you for real? Okay, so yes, I am Dr. Frida. I am a nephrologist. I am a kidney specialist. But SLS, I'm also a high blood pressure specialist. I don't even know if this is a joke or not. So here's what you may not know, SLS. The kidneys are responsible for regulating your blood pressure. In fact, when I get patients, when I get referrals, they come from other specialists like gastroenterologists who are stomach doctors. They come from endocrinologists, like diabetes doctors. They come from hematologists, oncologists, or blood doctors and cancer doctors. And you know what they tell their patients? I'm referring you to Dr. Frida, who is a nephrologist and a high blood pressure specialist. I'll just give you a couple of things. We talk about salt and how sodium controls blood pressure in a lot of ways, right? Too much sodium can lead to high blood pressure. Well, guess where your salt is regulated? In your kidneys. We talk about, in one of my videos, high potassium, and how a high potassium diet can help to lower the blood pressure. Where's the potassium regulated? In the kidneys. There's also other things, your renin-angiotensin system. And when you have low blood pressure, your kidneys kick in to help your blood pressure to be at a proper level. When you have high blood pressure and excess fluid in your body, guess what organs help to get rid of that fluid? The kidneys. So yes, I'm a nephrologist, I'm a kidney specialist, and I am a hypertension, high blood pressure specialist. Why? Because it's the kidneys that help to regulate high blood pressure. SLS, you need to stop.
What if you are unable to burp or fart? Is that a sign of kidney failure? By Anti.
Okay, Anti. If you are unable to burp or belch, or if you're unable to fart or flatulate, that is not necessarily a sign of kidney failure. I want you to watch my video on some of the signs and symptoms of kidney failure after you finish watching this video. Now, if you're having digestive issues like that, which it sounds like you're describing, that could be, an issue with, of course, your digestive system. You could be constipated. You can have an autoimmune disease like Crohn's disease, ulcerative colitis. You could have reflux disease. There's a long list. And, in some cases, especially in advanced kidney disease, you may also get some stomach gastrointestinal problems. But if you are not able to burp or fart, as you say, that is not necessarily a sign of kidney failure. I thank you for your support. What's the next question?
Lately, I've been smelling ammonia, especially at night while sleeping. My GFR is 50. I've been in stage 3 CKD for over 5 years now. Is smelling ammonia normal? By Verge.
Thank you for that question. Okay, so you have a GFR or glomerular filtration rate of 50, and you've been in CKD stage 3. I want everyone to watch my video on CKD stages after you finish watching this video to understand that. Now, that's a moderate stage of CKD. It's not very advanced. And we talk about this ammonia. Sometimes people who have more advanced kidney failure, especially when you get to CKD stage 5, will have a breath that smells like ammonia or that actually smells like urine. If you are having a sensation of smell of ammonia, that's not necessarily a sign of kidney failure. But I certainly would recommend that you go to your nephrologist to get some updated kidney numbers and to be sure that you don't have something else going on. But yes, that ammonia or urine smell of the breath can be associated with kidney failure. Also, if you have kind of a sweet or ammonia smell of the breath, it could be associated with diabetes. So I recommend that you go to your primary care physician and to your nephrologist and make sure that you have updated numbers and that you get a full physical exam to find out what this means for you. Thank you for the question.
Is it safe for someone to stop medication for diabetes and high blood pressure when the measurements go back to normal for 2 to 3 months? By IB.
Ooh, great questions. And if you're talking about yourself, congratulations for those numbers going down. Who asked this?
IB.
IB. Okay. I don't recommend that you stop diabetes, high blood pressure, or any medication without consulting with your physician. Now, if, for example, you've had lifestyle modifications, I do have patients who are able to come all the way off of diabetes medication, off of insulin. Also, patients with lifestyle modifications, weight loss, many can come off of high blood pressure medications. But I always recommend that you do it under the consultation of your physician. I don't recommend just stopping yourself at home.
How about that tingling sensation and numbness of the left leg to buttocks? Is it also a sign and symptom of heart attack? By Mary Lou.
Thank you for that question. This one came under the heart attack symptoms, 7 warning signs you should never ignore. Now, we know more classically, we think of one of the symptoms as being a tingling of the left arm or shoulder or jaw, but we know it could be both shoulders, both arms, and you can have all kinds of symptoms that aren't typical. A classic one is not a tingling of that left leg or buttock, and you want to make sure that you consult with your physician because you could have some type of a neurological issue. For example, you could have sciatica, or you could have an issue with your spine, like your lumbar spine or something going on in your vertebrae. You could also have a circulation issue as well. Make sure you consult with your physician because that is not a classic heart attack symptom, but you definitely want to make sure you have all of your updated heart tests and evaluations completed.
What's your take on statins? I am afraid to take them due to the adverse side effects, loss of muscle, and brain function. Over 60. By Jody.
Jody, your question is right on time about statins because the U.S. Preventive Services Task Force just came out with some new guidelines for statins, which are cholesterol medicines, but they also have benefits to prevent heart disease and stroke. In the study that they actually reviewed 26 studies, and they looked at over 500,000 patients. So it was a really good data set. And what they found time after time after time, the patients who used statins, who took the statins, had a decreased risk for heart attacks and strokes. And those risks were minimal. The risk that you're talking about did not outweigh the benefits. And so now the recommendation is that if you're between the age of 40 and 75 and you have at least one risk factor for heart disease, like diabetes, for example, and if you have a 10% chance for having a heart attack or a stroke in the next 10 years, it's recommended that you take a statin. Now, actually, the American College of Cardiology and American Heart Association also recommend statins, but they're even a little bit more strict than the USPS. They recommend that if you have even a 7.5% as opposed to 10% risk of having a heart attack or stroke in the next 10 years, that you take a statin. And if you have diabetes, for example, they say don't bother calculating the risk. Just go ahead and take the statin. And so my stand on statins is that their benefits far outweigh the risk, especially if you're between the ages of 40 and 75.
Do you see patients in New York City? I would love to have an appointment with you. From Marie.
Thank you for asking. Yes, I see patients in New York City, the Big Apple. I have a telemedicine practice, and so please make sure that you click my link and get the information, and I'd love to set up an appointment and to meet you. Thank you.
How long after changing to a high blood pressure diet will I start to feel better and see consistency? By Shirley.
Thank you, Shirley. And I see that you put this question under my video on 15 foods to avoid if you have high blood pressure. If you make this lifestyle change, the answer is going to vary from patient to patient. It depends on how far along you've already been having a healthy lifestyle. But for most people, within 2 to 3 weeks of being consistent, they will start to see results. They will start to see the blood pressure lower. And beyond just having the foods that are low in sodium and that are heart healthy and high blood pressure friendly, you also want to make sure you have the exercise and you are, trying to get toward a healthy weight. All of these things in combination will help you. But within 2 to 3 weeks, you will start to see results in most cases, but it could take longer. Don't give up because definitely having these heart healthy diets it's going to help you for the long term. Thank you, Shirley. This was fun. I hope y'all enjoyed it. I certainly did. And if you found this video to be helpful and informative, please be sure to share it with the people you care about. Again, if you have any questions, comments, please put them in the comment section below.